Does Telmisartan and Hydrochlorothiazide cause a cough? Have you ever wondered if the combination of Telmisartan and hydrochlorothiazide could lead to a cough? This is a common concern for many taking medications for hypertension. Let's break it down. Telmisartan is part of a group of medications known as angiotensin receptor blockers. These medications are generally well tolerated and have a lower chance of causing a cough compared to other hypertension medications, specifically angiotensin converting enzyme inhibitors. In fact, only about 0.1% to 1% of patients taking Telmisartan report experiencing a cough. On the other hand, hydrochlorothiazide is a thiazide diuretic. This medication helps control blood pressure by eliminating excess fluid from the body. Hydrochlorothiazide is not typically associated with causing a cough. However, it can lead to upper respiratory tract infections, which may indirectly cause coughing. When combined, Telmisartan and hydrochlorothiazide work effectively to lower blood pressure. This combination is often preferred for patients who may have experienced a cough with other hypertension medications. Since cough is less common with Telmisartan, it can help improve adherence to treatment, especially since hypertension often does not show symptoms. If you are concerned about side effects, it is always a good idea to discuss them with your healthcare provider. They can provide personalized advice based on your health history and current medications. In summary, while it is possible for Telmisartan and hydrochlorothiazide to cause a cough, it is relatively rare. This makes the combination a suitable choice for many individuals managing hypertension. If you have any concerns or experience any symptoms, reaching out to a healthcare professional is always the best course of action.